Hi, I'm Abby Lucas, and I'm one of the social workers here at Froedtert in the Medical College, Wisconsin, and I work with the kidney transplant team. I'm here to talk to you today a little bit about why a social worker is a part of your transplant team. I want to make sure that you have all the resources you need to take care of a transplanted organ. As you're probably learning from some of the other videos, there's a lot that goes into having a kidney transplant, both on the front end and the back end. That can be a very complicated thing to go over. It can create a lot of new questions about like life things, like how does anybody realistically fit these things into their life? Well, I really want to make sure I have the chance to talk to you about that because I think those are very realistic, good questions. So when you come and see us for the first time, we're going to go over a lot of the parts of transplant that are maybe not quite so medical. We'll talk about your social support. We really want to make sure that you have a good plan in place when the time comes for transplant, because we know that our patients who have some help managing all these responsibilities after transplant are the ones who they're going to have a better outcome. We also want to make sure that we take care of things like work and school. Transplant is a bit of a marathon, more so than a sprint. So it gives us a little bit of time to talk about these things and create a plan for, let's say you are unable to work during your recovery, or you're unable to work leading up to the surgery because you started dialysis. We'll go through a lot of those scenarios just to make sure that we have a good plan in place to meet all of your needs. We'll also go over transportation. We want to make sure that you have a ride to the hospital if you get called in with an organ offer, as well as all of the follow-up appointments on the back end. We also want to make sure that you have a good, safe home to return to when you discharge. So we'll talk about things like making sure that housing is paid for, that you have the financial means to do so, and that you have a safe place to return to. We also want to have a little bit of a discussion about finances. We work hard with our financial liaisons to help you come up with a financial plan leading up to transplant and the recovery. And we're also here to talk to you about Social Security and any questions you have about navigating that system. We'd love to talk to you about advanced directives if you're willing. Namely, that means a medical power of attorney for healthcare. That is basically appointing somebody who would make medical decisions on your behalf if you would ever need to. We don't anticipate that being something that you would need for the purposes of transplant, but no one ever really anticipates having to use those documents until they're in that situation. And it's always nice to just have that in place and have those discussions with your loved ones when making those decisions. We'll have a discussion about adherence, and adherence is a fancy word for how well you follow doctor's orders, take your medicines, keeping up with your clinic appointments, just because transplant is really more of a treatment for your kidney disease, not so much a cure. So it still requires some work on the back end, and we're going to want to make sure that we're establishing good habits before your transplant. We're also going to have a discussion about your mental and spiritual well-being, and we want to make sure that you have all of your emotional needs met. And by that, it's very, very common for our patients with chronic illness to suffer from things like anxiety and depression, and have those be a part of their everyday life. And those are not things we hold against our patients, but they are part of taking care of all of you. And we want to make sure we talk to you about what's available on our team to assist with those needs. We also want to make sure that we're addressing your spiritual needs and getting you involved with chaplain services if need be. We're also going to talk to you about alcohol use, tobacco, and any history of other drug use, because we want to make sure that we're doing everything we can to keep you healthy and take care of a precious resource like a transplanted organ. It is very important that you bring someone with you to your first visit with us. It's a long appointment. You're going to meet a lot of different people, and it can be overwhelming because we're talking about you and your body and your health and a lot of processes that might be very, very new to you. So we want to make sure that you have another set of ears there to take in some of that information if you're feeling overwhelmed, and as well somebody who could maybe receive some caregiver education, because we want to make sure that we come up with a plan for transplant where somebody is able to help you with a few things after your surgery. So for our patients who have a living donor, that is a planned surgery. That is something we can put on the calendar. That is something that you might even have the opportunity to know which doctors are going to be there during that time, because it's all going to be laid out ahead of time. We don't have that luxury when we're working with a deceased donor kidney. Many of our patients don't have living donors, and that's okay too. But one of the things that we have to keep in mind is an emergent transportation plan. Once your name comes up on the list and a kidney becomes matched, you could realistically be called into our clinic anytime. So we want you to be ready to have a plan to get here morning, noon, night, weekend, holiday, doesn't really matter. So as long as you have a plan in place to get here, we understand that many of you live a couple hours away, and we're able to get our patients transplanted with good quality organs when our patients come from a little bit of a distance, as long as they have a transportation plan in place. So when you come to the hospital for your transplant, we expect you to be here about 3 days, sometimes longer if we have complications. Sometimes it's about 3 to 5. And when you're here, you'll be up, you'll be moving. We want to make sure that you're active and that you feel good, and that when you go home, you can do quite a few of those physical tasks for yourself. In the time that you're here, we're going to want to make sure that somebody in your support system comes here to go over all of the medications. There are a lot of medications that go into a transplant treatment plan. And at first, I mean, you just had major surgery, and you might be taking new medications you've never taken before. You might not feel quite like yourself. It can be really, really hard to learn about these meds, but they're so important. And so we want to make sure that while you're learning about them, somebody else is learning about them too, and can support you with this when you go home. When you do go home, we would not want you left alone for at least a week. Sometimes longer if needed, depending on how you're doing. During this time, we would want caregivers to look for a few things. One, we want to make sure you're eating and drinking okay. Hospitalizations have this weird effect where we tend to lose sense of time and our appetites change. It's pretty normal, but we want to make sure that you're eating all the meals you're supposed to be eating and taking in those calories, because it does help heal from your surgical wound. We also want to make sure you're drinking a lot of water. And for many of our patients, that's a new habit. Hopefully you're already in the habit of staying well hydrated, but many patients who are on dialysis are asked to limit the fluid they take in. So this can be a whole new habit to build. It's always good to have somebody there to remind you to be taking in your water. Another thing is we want to make sure you're taking your medicine correctly and on time. As we said before, that's a very, very important part of this. Another thing that we really want your support system to be aware of is you might feel a little bit different emotionally when you first go home from the transplant. Some of that is because you just experienced this major life event, and I think it's realistic to understand that can make anybody feel some strong emotions. But we also give you medicine that might make that a little bit worse at first. You'll be taking a medication called prednisone. It's a steroid, and so it can increase your anxiety. It can make you feel a little bit more depressed for some people. Prednisone can also make it harder to sleep. So you put all those things together, it's just good for somebody to be there to be able to ground you and remind you that this is temporary. Eventually, we'll take that medication and wean it down to a smaller dose where you really shouldn't be experiencing those side effects anymore. So when you discharge from our hospital, it's pretty common to need some medication to manage your pain. And while you're taking that medication, we're not going to want you to drive. So plan for about 3 weeks or so of needing some assistance with driving, getting to all your follow-up appointments, and some running some of those major errands. And we know that's challenging because that's also when you have to be here the most. So after your surgery, we're going to want you to come see us here at Froedtert at the main campus about 2 to 3 times a week for about a month or so, okay? We're going to have your labs done. You'll see your surgeon. You'll see your transplant nephrologist. And we're going to want to make sure that you get those labs done here for at least a month, because that's how we know we're treating you correctly and we get those results very quickly. After the first month, you can go ahead and work with your transplant coordinator for a better location, a more convenient location to get those labs drawn if possible. We're not going to want you to lift anything heavier than 10 pounds for about 8 weeks or so. We want to make sure that you are not uncomfortable and that we're avoiding any kind of wound infection or hernia or complication at the site. So those are good jobs for grandkids, for young kids, to be helping with laundry baskets, grocery bags. We also want to make sure that you are avoiding snow removal and lawn care. Sometimes when people come see us, they're concerned because they don't feel like they have the ability to develop a support plan. We still want to make sure we talk to you about these things because we may be able to help you access some community resources to make your support system a little bit more robust. Everybody's support system looks a little bit different, whether it be family, friends, neighbors, church community, personal care workers, or a combination thereof. And we want to make sure that we address all of the opportunities and possibilities as to how we could help you obtain the support system you need to be successful with a kidney transplant. So while your transplant team is going to be taking care of you and your transplant related needs for the life of this transplant and of this organ, it's very important that you follow with your primary care provider. We are happy to partner with them and make sure that we're taking good care of all of you. Sometimes when we're taking in the time to learn all that we can about kidney transplant from all these professionals, we can still have a lot of questions. And sometimes I feel like many patient questions are best answered by somebody who's done this before, which is why that we have a peer mentor program. We have patients that we've transplanted in the past. They're at a good point in their life and in their recovery to talk to you about your experience and validate some of the experiences and feelings you may be having right now. As your social worker, I would want to make sure that we have the chance to talk about whether or not that's something you feel you'd benefit from. It's not required, but it can be an extra layer of support and a whole extra layer of wisdom for you as you're making decisions about kidney transplant and how you'd like to move forward. We have that same program for our caregivers as well. As we talked about all these caregiver responsibilities after a kidney transplant, it is normal for caregivers to also feel a little bit overwhelmed. We want to make sure that we give them the opportunity to speak to somebody else who's taking care of somebody who's had a kidney transplant. So that way they have somebody who can speak to that firsthand experience. There's a lot of life stuff, as we've gone over, that goes into how we live our lives with a transplanted organ. And there are some risks, life risks, I guess, associated with a kidney transplant. And I think it's fair that you know all of the things that we're looking for and that we want you to be looking for before we kind of go into, before we pursue transplant. Like I said before, mood changes with the prednisone. That is something that our patients experience sometimes, and we want to know if that's going on. There's ways that we might be able to help, and we do know it's temporary, but we want to make sure that we're taking care of that. Sometimes, surprisingly enough, the family dynamics can change. A caregiver or a partner who was a caregiver is maybe not having to do those things like they had been before somebody's transplant. And that can be somewhat challenging when much of your identity or your role in the family is wrapped up in that caregiver identity or the sick person identity for the patient. And that can be challenging to have to kind of redefine that. Sometimes transplant can put you at risk for things like body image issues. You're going to have a scar on your abdomen. That can be a new experience for some people. And we want to make sure that you're maintaining a healthy relationship with your body, with diet, with exercise. So those are things that we'll want to talk to you about after your surgery. It is also normal for our patients to experience what is called survivor's guilt. And that is feeling guilty or bad about maybe some tragic circumstances from a deceased donor that led to your new transplant. And it's okay to have those complex feelings. It's very normal to feel more than one thing at any given time as you go through this journey. And as your social worker, we're going to want to make sure that we have the chance to talk to you about all sorts of ways that you can honor your donor and their family, and if possible, involve some mental health resources to manage some of those feelings as well. So why get a kidney transplant at all? Well, many of our patients report just generally feeling better after their transplant. After the initial recovery, which takes a few months, they report having a little bit more energy, being able to do things that they hadn't been able to do before, and obviously freedom from dialysis. That can be a big quality of life enhancer, giving you some of that time back, some of that wellness, that energy, the ability to travel, possibly return to work or school, and in general, hopefully live a longer life. Thank you for taking the time to listen and learn, and we hope to see you at Froedtert in the Medical College of Wisconsin soon.